So she's not to be trusted either way. But for those of you that have a matrix, skin does not look like this.
No.
Immediately on the lowest setting. This is the lowest setting the machine has. Imagine as it gets stronger and stronger, this blows away. This gets much more like CO2. So this is the lowest setting you can get. It doesn't get any lower. And you get a tremendous edema and erythema because you're getting combined ablation and sublation.
Can we make the energy lower than 10?
You can't. This is it. It doesn't get any lower. I've never had a patient.
Yeah, I know. I mean, if the company can make the energy lower than 10, can it make me like non-ablative?
Well, then you'd use Factora Firm. You wouldn't need this.
I know.
That's the one where there's no needles, you're just moving it around, you're creating heat. You don't have one of those type of applicators, but it's a great technique for tightening. Just moving, gets up to 42 degrees, they're edema, swollen, but there's no ablative little columns. That's Factora Firm, that's what you'd use. Once you get less than 10, you might as well go non-ablative anyway. You might as well go to the non-ablative RF, just for tightening.
Should we sterilize this? Because
You just throw it out.
Huh?
There's too much, there's going to be, see that black stuff on each of those electrodes? This is ablated tissue, you just throw it out. Throw it out.
So those are consumable tips.
Yeah. But again, I would encourage you to treat tons of areas of the patient. Say, you know what, for an extra $100 we'll do the back of your hands, or we'll do your throw your neck in, or, you know, because you've got unlimited pulses here, you might as well give the patient the best outcome.
So one tip as much as you want.
As much as you want.
So
Now, I know some patients actually take the tip, put it in a little baggie, clean it with a toothbrush. They might get 2 treatments out of it. But it's not that the company's trying to be cheap. It's that there's dead skin around each pin. You can't get rid of it. And then you lose your RF conduction, and the patient's getting ripped off because they're not getting good RF penetration.
Do we need to clean the tip in the middle of treatment?
If you're at 60, yes. So I get one of those little scrub brushes from the OR and just clean it. Or have a bunch of toothbrushes around the clinic and just clean it with toothbrushes. If you're at 60, there's all kinds of eschar, and that builds up. You can imagine this at 10. Imagine if we did that at 60. You know, there'd be a tremendous amount of ablation. You're doing great, young lady. We're almost done here. She's stunned into silence.